Okay. I love these colors. They look so good. Okay. Yeah. Now we're going to talk about hemolytic disease in report. And this is going to show up again, so the sweat's in red. The mother, if the mother is Rh negative, and the baby is Rh positive, that's when you have problems. If both mother and baby were negative, it wouldn't matter. There wouldn't be antibodies being formed. But because mother's negative and baby's positive, the mother can at times mix with the baby's blood. And that can happen if they have a partial miscarriage, but a totally miscarriage. This can happen during the pregnancy, not just at birth. If the mother's spotting or bleeding and she's an Rh negative mom, carrying an Rh positive baby, she may get that mix and start creating antibodies to the baby's blood, which feasibly she can destroy that baby, depending how many antibodies she produces. So they say the second birth here, but it can happen if she partially miscarriages or does have some bleeding during her first pregnancy. Every time, if the mother doesn't get a program, which we're going to talk about in a minute, it prevents the antibodies from being formed. If the mother does not get the program, every time she gets pregnant and carries an Rh positive baby, the baby will be destroyed sooner and sooner and sooner. Pregnancy. It's a very serious disease. Until they discovered what was going on, a lot of people lost babies, a lot of miscarriages. But nowadays, yay, we have. Can I read it? Okay. Oh, I'm going to talk about it further. Okay. I'll just talk about it further then. So we give to these moms called program. It stops the antibodies from being formed, and they will get it during their pregnancy and definitely 72 hours after the baby is delivered. It prevents them from creating antibodies to their next baby. And so it's prevented a lot of fetal deaths. So it's an awesome thing that's happened. They've come up with. During your pregnancy, if you were an Rh negative mom, you'll be getting antibody testing done during your pregnancy. See if you have created antibodies to your baby. But that one particular drug has saved a lot of lives. Okay. There. Okay. Now we're going to ask what are the type of white blood cells? And of course, you know your white blood cells are your protection. They work with the immune system. Excuse me. They're called leukocytes. They do not carry hemoglobin. They have a nuclei and other organelles, so that means they can reproduce themselves. They're not like red cells. They can also repair damage themselves too. There's a lot of information here. So white blood cells, they defend against pathogens and they remove toxins and waste and attack abnormal cells. So these abnormal cells are your cancer cells, right? So anything that's going to be abnormal, they're going to take care of. They're going to try to destroy it. When you get your blood work back, and you get your blood work taken from one of your patients, and you get your results back, a high white blood cell count will indicate that they've got an infection. Because as soon as the pathogens start coming into the body starts producing a whole bunch of white cells to defend against it. So depending on how severe the infection is, the higher the white count, the higher the severity of the infection. They're located in connective tissue and lymphatic system. They're not just in the circulatory system like the red cells are. They can actually migrate in and out, move through the walls of the vessels into the cells. They can move around. This number you don't have to know about, but this is a normal range. So if you saw a range of 12,000, then you're going to start thinking this person has an infection. Losing my voice again. There's 5 different types: neutrophils, eosinophils, basophils, monocytes, and lymphocytes. When you get your blood work back down, they'll have a white blood cell count and a differential. You'll get on there. And the differential shows the difference in these cells. So if you had a viral infection as opposed to a bacterial infection, you'll have more eosinophils, or you'll have more basophils. And that tells the doctor whether it is viral or it is bacterial infection. So that's what the differential does when you see that in your white cell count when it comes back. Now I'm working 4 days in Ashcroft this week, and I'll see if I can pull a bunch of blood tests for you guys. I'll take the patient's name off, of course, but then I'll just give you a copy so you can just have a look at them and get used to reading lab reports, because you are responsible for that. Even in acute care, where I have the girls in Penticton, it's their responsibility to look at those lab results coming back, see what's high and low, and report it to their RN or report it to. So we do hold responsibility for lab results. So, like I was saying, they can move out of the bloodstream. They can go through blood vessel walls and move into tissues. They have an irregular shape, and they can change their shape so they can push through between tissues and between cells. Attracted to chemical stimuli. The reason chemical stimuli is important is if there is damage in cell walls from a bacterial infection or a viral infection, they put out chemical alarms. And they're attract the white blood cells to say that they're being attacked and they need help. Some of the phagocytic ones are neutrophils, eosinophils, and the monocytes. So what does that mean when we say phagocytic? The nose. Yeah, what is it? Eats it, it kind of rests.
The inflammation response, right? Inflammatory response, the neutrophils, things like that.
Then these phagocytes respond to inflammation. But they just, that's what they do. Like they destroy, right? They wrap themselves around the You've been doing some memorization.
Yeah, I have a little slang that
Okay.
it's the only way I can remember.
it. That's cute. So the neutrophils are 50 to 70%, which is quite high, of the circulating white blood cells. This is just kind of information. You don't really need to know that. Memorize that. It's extra information. Okay. Oops. Okay. Neutrophil action, they're highly mobile, and they're first to arrive at the site of an injury. So they engulf and digest pathogens, which could be any sort of bacteria or something that's in a wound. They release these chemicals, prostaglandins actually is and leukotrienes, that stop the spread of pathogens, to keep them just in the area around where the, say, the laceration or cut was. They form a pucky stuff. But the pus itself is just dead cells, not really portable. And they can live for 30 minutes to 10 hours, depending on the need, how long they're needed. Eosinophils, a smaller portion, they're only 2 to 4% of the circulating white blood cell, and they are attack parasites. So parasites like fever, it's quite common here, not just the Merritt, I mean in the Okanagan, have a lot of that. So they kill parasites by excreting toxic compounds, nitric oxide, cytotoxic enzymes. Now, like I say, this is for your information. More. But it's just to know that these eosinophils are attack parasites. Looks like we don't have a lot of parasites, we have 2 to 4%. That's good. It'd be interesting to see what the blood counts would be in Africa, where they have a lot more parasites than we do. Yeah, it might be a lot higher. There's your inflammation right there. Remember you were saying eosinophils. Set limits on inflammation caused by neutrophils by releasing specific anti-inflammatory enzymes.
So
How did that jog your memory when you saw that? Yeah.
Because I remembered all 5 of those steps. Yeah. I heard all of them on, and there wasn't even on the test.
I know. It's really frustrating. Tests don't tell us a lot about what it is. I would rather go to a unit, like to the hospital, and work with you guys and see what you know. Because tests are just like memorizing and then regurgitating it on the paper and forgetting it as soon as you walk up the exam room door. But yeah, so.
Or if you're like me, I do kind of bad on tests, but I have a hard time reading things. So it's not that I don't know it, it's I'm not interpreting the question.
Great. Or you miss the not or the except in the sentence. Yeah. And multiple choice is really hard for that. They always add. Or you turn the page, and one of the, I noticed, I don't think it's this exam, but I noticed in one exam that I had seen, there was the question, and there was 3 choices on multiple choice, but the last choice on the next page was all of the above. So it really messed people around. It would have been on the same page. It would have been nice. Yeah, exactly. I would have picked one of the 3. Yeah, and then flip the page and went, oh, that's wrong. Anyway, so basophils, they're very small percentage, it's 1%, and they're small. And they release histamines into the injured area. So histamines cause capillary dilation, which enhances inflammation. And if you have allergies like I do, I release a lot of histamine. So no, when you have an allergy, it's like, you know, your sinuses kind of fill up, you start sneezing, so there is congestion and inflammation with histamine release. They also release heparin, which prevents clotting. And now that sounds a bit odd, but when you have an injury and you want to clean up the clot, get rid of it, heparin is released because it's an anticoagulant. So the basophils, if you did have a clot, they thrombosis of some sort, you have a clot, and they did blood work, and it showed a high concentration of basophils. It would hint to the doctor that you do have a clot somewhere. So it is important. Monocytes. They become the macrophages. They can release chemicals that attract other white blood cells to come in and help fight the infection or the toxin of some sort. They also secrete substances that attract fibroblasts. The fibroblasts show up in injured tissue. Lymphocytes. This is going on forever. Anyway, I'm thinking I've got to do endocrine yet. It's got to be fitting before the exam. So 30% of the circulating white blood cells. Yeah, what's that? This is so many. I know. It's like, oh my God. Well, I know there's something like. Well, I cut them down. I mean, there was 97 to begin with. And I'm going, oh my God. I think I cut them into the 80s. But like I was saying to Danielle, the exam is heavily weighted on blood. So that's why you're getting so much information about it. Important information, yes. So this is interesting too, because they are mostly in the connective tissue and lymphatic organs. Lymphatic organs, they're like your tonsils, they're lymphatic organs. So they're kind of stored in there, and they only come out into circulation. On a small amount of time. So if there was any damage or there's any infections, the lymphocytes, you see an increase in those as well. More would be put out into the circulatory system. Classes of lymphocytes are T cells, B cells, and natural killer cells. And it's all in red. And we're going to talk about each class. Remember, this will be important. T cells, mediated immunity, attack foreign cells directly by entering into the infected tissue and control the activities of other lymphocytes. So they're the controllers for the other ones.
Are the T cells the ones that like to do with AIDS?
Yes.
HIV? Yeah. Do they have too many or not enough?
Not enough. The B cells produce and distribute antibodies, and they don't need to go to the site of infection themselves. And they're responsible for humoral immunity. Natural killer cells responsible for immune system surveillance that can destroy abnormal tissue cells and mutations. So they're the ones that work on the cancer cells. So on the exam, if you saw this, you probably, the question would be similar to like, that can destroy abnormal tissue cells, especially with cancer. And then they can give you a list of the cells. And they go T cells, B cells. So it's the natural killer cells that looking for with that. ran away on me again. So the differential, we already talked about the differential. It gives you an idea of what type of attack the body is under, whether it's inflammatory attack, bacterial, viral, that type of thing. So white blood cell disorders, leukopenia just means, when you see penia, it's less or smaller. So if you ever see that at the end of a word, that's what it means. So it's just a low count. Leukocytosis is an abnormally high count, and leukemia, extremely high white. But when they say that, these white blood cells, they may be high, but they're deformed and they're not functional. White blood cell production, all blood cells originate from hemocytoblasts, and the blast is always building in the bone marrow, which produce myeloid and lymphoid stem cells. We've already actually talked about this a little bit earlier. You might have notes already. I think you do. Yeah, we do. This red cells. So white blood cells, except for the monocytes, develop in the bone marrow, and the monocytes develop in peripheral tissue. That's the only difference there. Yeah, it's repeated. But then again, when you see something repeated, you don't import it, right?
Just break that down.
What's that? Yeah. I think I just know this is important. Yeah, right. Lymphopoiesis. Some lymphoid stem cells migrate to peripheral lymphoid tissues, thymus, spleen, and lymph nodes. And they also produce lymphocytes. Function of platelet, circulating. Okay. So thrombocytopenia, remember I was saying whenever you see penia at the end of a word, it's always going to be less. So abnormal low platelet count and thrombocytosis abnormally high platelet. Three functions of the platelets: they release important clotting chemicals, and they can temporarily patch a vessel. And this one here contains actin and myosin that contract, therefore shrinking the tissue. So where else did we have actin and myosin? Muscle tissue, yeah. That's a nice review. It kind of makes sense when you think of actin and myosin, how they work in contraction, and it helps contract the tissue after a clot formation. So it's doing kind of the same job. There. That's getting bigger and bigger. Oh, this is too much.
I know, I write so hard that this.
You have a lump one. I have a lump, permanent lump one that I use so much.
Which is very resistant, like
So platelet production, called thrombocytopoiesis, and it occurs in the bone marrow as well. Bone marrow does a lot of work other than just being bone. Yes, it is. We can break it up into thrombo and then cytopoiesis, the last part, just break it up to three. Whenever you're dealing with the word, the prefix thrombo, you're dealing with blood of some sort. Hemostasis, cessation of bleeding. Vascular phase, the platelet phase, the coagulation phase. And we've talked about this with our bone fractures before. Okay. You know, you have been introduced to it before. I might go a little faster because I'm something to do that. So you can see that the vascular phase is when the vessel goes into spasm, as you can see here, and it just closes it off. And it usually lasts about 30 minutes. So when someone has an amputation of a limb, the vessels actually close off and they don't bleed as heavily. If it's left and you don't wrap it or pack it or whatever to prevent the bleeding, it will start bleeding again. So it gives you some time to do a dressing on these people if they've been So the endothelial cells of the vessel contract, and endothelial release chemicals that stimulate cell division. And the endothelial cell membranes become sticky, sealing off. Okay, so I'm going to go through these a little bit quicker because we've done it before. So I'm a little bit worried. Similar diagram that you had when you did the bone fracture. And the platelets adhere to the sticky endothelial surfaces and expose collagen fibers, and they form a plug by sticking together. Platelets stimulate clotting. If you want me to stop, because I said I'm just going to go through these really quickly. The coagulation phase begins in 30 seconds after the injury. So the blood clotting coagulation converts circulating fibrinogen into fibrin, which are the mesh, right? It starts making a mesh so it can collect up all the different particles of blood cells and so forth. You need to know those words. Fibrinogen and fibrin, yes, you do, and it's in your bone fracture one as well. So this is like a bit of a repeat. Okay. So I'm just going to read through them. The enzyme plasmin digests the fibrin strands during the later stage of the wound. Fibrinolysis. Whenever you see lysis, it's the main. The other thing that we need to know is calcium has come up again. Calcium is common in a lot of functions in the body. So calcium ions and vitamin K are essential to the clotting process. If you have somebody who's on warfarin or an anticoagulant, often a lot of people are on warfarin. It seems to be a very common drug to use because of cardiac problems or deep vein thrombosis clots. Vitamin K is the antagonist. If they were to have too much warfarin, too much heparin, we would give them vitamin K injection to start forming clots. You need vitamin K before you can have the clotting process. So eat lots of rhubarb. That's where it is. Rhubarb. Yeah. There's a lot of different vegetables, but rhubarb's really high. So just quickly, bleeding time is usually 1 to 4 minutes. Doesn't really last that long. When you've got somebody with an epistaxis, which is a nosebleed, and you're pinching it, you have to pinch it for 10 minutes. It seems to last forever. Your fingers get blue. Yay! So it's 3:30, 4:55, a couple hours, which is great. Did you want to take another short break? Short break, and then we can come back. Yep. Yeah, 40 to 10. And then I'll get the next slide ready for the endocrine, okay? While you're having a break. So students at home, we're going to take about a 10-minute break and have a break. And we'll be back to do the endocrine system in about 10 to 12 minutes or so, okay?
gain weight. Okay, just checking that in. There's a ability to yeah. Urban 140 what I said to the other one. Oh yeah, everything's possible. Isn't it? That's a second year. Lower section of we only have one test this week, don't we? This one. Yeah, and then I'm gonna hand in the papers. Just one test this one. And then the week after. Here's one line. Yeah. And our pharmacology exam, that was supposed to be on the 3rd. Yeah, she's changing it to the 8th. Really? Yay! Mm-hmm. I am sad that I thought it was kind of disappointing that Brooklyn was like, every do somebody, it's like discouraging comments. Like, how could you say that when people are already down to themselves? Exactly, right? Where they're like, look at this, like, 3 or 4 girls. Just from that math. I know memories was like, look at that, where did I go? That was hilarious. You do that. Yeah. We have to redo and again. I'm pretty sure I'm ready because one of the things that helped me is a solution is that I've tried it 3 or 4 different ways and really just clicked. So I'm like, yeah, and then Jose on top of that is on there, like, he's right beside me the whole way. He's like, I will not let you. Like, he is straight up, like, I did the exam and I messed up with per day. I wrote per day, it's supposed to be per dose. He's like, that right there won't get you. I have a point that's not 100%. I had it all except for that one number. But he was like right on point. He's like, I will not let you fail on me. That I believe in you and I don't want you to leave. He's like there, constant. That part of me, but he says I'm getting really past that part of thinking on her study techniques works. But having to listen to yeah, we were so pissed off when everyone was like, thanks so much, Lisa, for helping us pass. We still didn't help you pass. You could study with anybody. Yeah. We were so mad. Yeah. Like, you did that all on your own, not Lisa. Don't. Oh, we were so mad. Yeah, we got it on your own because your mind was set. I told my brother and I said, 1% drugs we this was all one because I said that's the person that seems to think the way I think in that certain manner where I get it. And she's like, oh, well, that's weird. And she's almost, I said, and I told her she had one, she's almost racist. Dominating person you could be around. And she goes, well, how come? I said, because I need that one person. Whatever, however she does it, because I need to come across the way I see it. And then it goes, I don't know why that is. But it's also not just her, there's Lori's thinking and Lindsay's thinking in there. And when it got there, they start talking about it all. But they don't see that, right? Because they're thinking he's bringing, but it's not that whole group. I can't even figure out where she is. I can see that. But she rolls her eyes down.
That one that she made the reflection that we had to write, I wrote 4 pages on about. So I was a little bit mad at the back.
It is so true that you really have to look at yourself and what it is, what you're doing. If you see people in a negative manner on those shows, that's not good. Because you have to be able to have an open mind for everything, everyone. No matter what they look like, what they smell like, if they're an addict, if they're not an addict, because they're a patient when they walk in the door. There's somebody that needs care.
I think too, like, what makes a really good nurse is somebody who's actually dealt with things that they're specializing in. You know, like, of course you're not going to know how to deal with somebody who does drugs or like understand their reasoning because you've never done that, or you've never probably had to face something so often difficult in your life that you would rather be high than deal with reality. And like, I was thinking about my own self. Like, I had something, and I never did like crystal meth, cocaine, or anything, but like I was into the party drugs, and it was because I was never able to deal with what had happened to me until I got support. Not everybody gets support.
No, guys are too scared to ask for it.
And that's why people go down this path.
Yeah, like just the other day, seeing my girl who's 14 years old, and she said she tried heroin for the first time, and she went from, I think she said Toronto, just to get away, like she said it, but she's like, there's no family issues. I just wanted around my house, well, how did you ever hear? Well, I don't know, it just kind of happened. And then she goes, and then I got here, and she was down on Navy, and she said she tried heroin for the first couple of times, and she said she was so anxious. And then the nurse that was something we were watching, isn't that wild? How she was saying, she just tried it, and I was like, wow. And then she said, can I go home? Do I have to go home? So kind of like you wonder if that was enough to get her.
Or if she was like, but even, there's a girl in Merritt, she was overdosed on crystal meth. She's 20 years old, beautiful, and it's like, what are you doing?
Well, and it's sad because now crystal meth is the most addictive drug. And it used to be heroin, but now it's crystal meth. Apparently, I've talked to different people who discussed it in courses and stuff, and it only takes 2 to 3 doses of it before you're addicted. So it's extremely addictive. It's terrifying, really. Because some people, and I'm sure that it is, but anyway, my niece, I'm sure she was slipped it in marijuana because she was a A student, quite normal, no problem. She was smoking marijuana occasionally, and she just went completely off the deep end of driving, just off the wall weird stuff. Yeah. And we kind of put it down. It took about 2 weeks before she calmed down again, and crystal meth takes about 2 weeks. You know, by the time you completely clear your system, the behaviors have stopped. Yeah. And yeah, it took about 2 weeks before she. And it's really sad because it was unexpected. She didn't want to take it, but it was put into mixed in with it. So, yeah, it was just really frightening for the family. But the scary part was that the addiction was, and we all worried for, oh my God, what if she comes to it? Unfortunately, that. But yeah, it's a very, very frightening drug.
It's even when the kids are, like, my cousin, she had surgery since she was small.
Mm-hmm.
She had been born without an upper part, so she had hair up here. But she had been on drugs from the time she was born.
Yeah.
All the way through. I was telling her, I said, it's not all you to blame because your body can even need those things and kind of trigger all these things and it led up to her addiction.
Yeah.
Because she was on it from the time she was born all the way up, and then she got pregnant, and then it was like the surgeries finally stopped.
Yeah.
And then it was like her body was still like really
Yeah.
And she's like, I never thought of it like that. I said, but do you think that with a lot of kids who have those issues?
Right.
That's probably why they have those addictions because they born on it.
Yeah.
Right from the time they were first born. And she was like, we're talking about my airboat. I don't know where it came from, but that was
It's just wisdom.
Yeah. Like, I had no idea where it came from.
Yeah.
I don't know why I said it was just not. Because you're smart, Brenda. That's not cool, Brenda.
Wise intuition. Wise wisdom. Yeah, it is very sad that happens. A lot of times, doctors give people these very heavy duty medications and stuff. Really, maybe they should be thinking a little bit further outside the box and give them something more tough rather than
They told us they couldn't get away from it because of the surgery and the hospital and all that.
Yeah, great. And usually for children they use codeine. Codeine is commonly used rather than those ones. They're all related, they're all different. Sad.
Yeah.
Anyway, so we're on to the endocrine system now.
November 8th period.
Pardon me? Yeah, the 8th. I'm working the 11th.
Good
That
holiday.
holiday. Yay! Yay!
That's in money in the bank.
Yeah, I need it. New roof on my house. Well, I bought it 10 years ago when I retired. Didn't ever retire. And it was an older home at that time. Just like the furnace is 35 years old. It's one of those. Everything's waiting to fall apart, so I'm trying to save some money to fix all this stuff. But yeah, it all happens. I like having those. It's fun. A lot of work though. I don't like spending my day up there fixing the roof. So the endocrine system provides long-term regulation and adjustments of homeostatic mechanisms. Fluid and electrolyte balance, cell and tissue metabolism, and growth and development. So that's its responsibility, the endocrine. That was weird that we weren't going to get this far. Like, oh my God, it's on the exam, we got to read the exam, we've got to do it.
Yeah.
Okay, done. Okay. Leave that with me, huh? Yeah. Okay, how are you? It has reproductive functions and assists the nervous system response to stressful stimuli. And here you're back at the gaps again. How many times have you guys gone through that?
A lot.
We're not going to do it today because it is actually at the very end of this program. There's about 10 slides. And we're going, again? Not. Okay. we're so obsessed with it. We don't know.
Big cats.
Yeah, I don't know what they got. Uses chemical messengers, factors or hormones to relay information and instruction between cells. And don't worry about this yet. Guys know that.
I was so mad. There was a question on the quiz and I got it wrong.
And
About that.
after you belabor the whole thing, I know it's like, how can I do that? Heard it so many times. Great. There we go. So the endocrine and the exocrine system, we've talked about exocrine and endocrine before, but just sort of a refresher, the endocrine cells are glandular secretory. The secretory part is what you want to remember with the endocrine. That release hormones or paracrine. This should have been in red too, okay? Paracrine factors into the bloodstream or tissue fluid, and they target specific cells or organs within the body. Christmas, we're going to give you some highlighters. So the exocrine cells, glandular substances, exit onto the surface of the body. That's like sweat. Exit onto the surface or into passageways that exist in the body. So that would be ducts, like in the pancreatic has ducts in it as well. Pancreatic is the only organ that has both exocrine and endocrine. We're going to repeat that. Target cells. The target cells are specific cells that possess receptors needed to bind or read hormonal messages. So the messages are sent, if you think of a key going into a lock, they're very specific. Like if the body was sending out messages to, let's say, the thyroid gland, it would be specific for that thyroid gland. The message wouldn't be sent to all of the rest of the body. It would just go to the thyroid gland and that's it. It doesn't go everywhere else. Oh, it was a big one. Anyway. The similarities between the nervous system and the endocrine system, they both rely on specialized chemicals and the availability of receptors and target cells. Well, specialized chemicals to your neurotransmitters across the synapses with the nervous system. That's one example.
I can see how confusing this gets because there's target cells and then there's T cells.
Yes, exactly. Yeah. And then that's why I don't like the use of the acronyms or the letters, because then you don't know if you're writing an exam and you see T, whether it's a target cell or whether it's a T cell. But fortunately, they're referring to them as receptors. So it's not so bad. Those receptors and target cells are probably something you want to get straight in your mind that they are virtually the same thing. They're regulated by negative feedback. Well, when they talk about negative feedback, And my example is insulin stops secreting when the blood sugars are too low. The blood sugars have to go through their cycle before they put in the negative feedback back to the pancreas to say it's too low. That's what I mean by negative feedback. And all these systems their goal is to maintain homeostasis. So hormones stimulate synthesis, production of enzymes or structural proteins. They increase or decrease the rate of synthesis and turn on existing enzyme or membrane channel on or off, producing a specific effect. And they circulate freely or bind to transport proteins. That's how they're getting around. Different tissues have different combinations of receptors, and that's when I was talking about the lock and key idea, is they're so specific to that organ or cell. Presence or absence of the receptors determines the hormonal sensitivity. So is it sensitive to that hormone that is coming through the circulatory system? Endocrine and the nervous system. Endocrine is unable to handle split-second decisions, but the nervous system is the crisis management for the nervous system. So endocrine, seriously? Pardon? They're all falling down. There's all these things back there that are falling off the wall. It is a full moon tonight. We could have gremlins or something. So endocrine can last a long period of time. It can last, for a few minutes, a few hours, or maybe even years. Because when you get into hormones for growth and development in children, those hormones can last for years. I should say those responses to that can last for years. Just a photograph of their locations of the endocrine glands. The hypothalamus, the pituitary gland is usually referred to as the master gland, but it does have a relationship with the hypothalamus, so it's almost like, I think the hypothalamus is a bit more of the master gland than the pituitary. The pituitary is the commander for all the other glands. Endocrine reflexes, the counterparts of neural reflexes, and we already talked about the negative feedback. They respond to negative feedback. Humoral, that's the word we saw before. It was highlighted in red, by the way. Changes the composition of extracellular fluid. hormonal stimuli, arrival or removal of a specific hormone, so hormonal stimuli, example would be the arrival of insulin on the cell membrane would stimulate the cell to open up, let some glucose in. Neuroendocrine reflexes, pathways include both neural and endocrine components. They're falling down. Keep taking them down and piling them up. Simple endocrine reflex involves one hormone and controls hormone secretion by the heart, pancreas, parathyroid, and digestive tract. Complex endocrine is one or more intermediate steps, two or more hormones. I didn't think of an example of two or more hormones in the same organ. The only thing I can think of is epinephrine or epinephrine. Talk about the different secretory organs. Hypothalamus, the primary role is controlling hormone production in the anterior pituitary. So there's a picture here of the anterior and the posterior pituitary.
By the shoulder.
Get online. So the hypothalamus is at the top. The pituitary gland itself is the little round gland at the bottom. And there is an isthmus which connects the two of them. That's long stem-like part of the pituitary gland. So we all know where the pituitary gland lives, don't we? Yeah. We do. When we did our bones. So the hypothalamus integrates activities of nervous and endocrine system, secretes regulatory hormones, and contains autonomic centers. The end of the day. There. Okay. Pituitary gland, I just showed you a picture of it. Divided into the anterior and posterior lobe, and they have different functions. Located deep in the cranial cavity on the sphenoid bone, cradled in the subturcica. You guys have heard both of these before when we did our bone structures. You can tell the importance of it because it's so well protected. It's right in the center of the brain, so it's got skull, all the bones surrounding it, and it's located right in the middle, so it can't be damaged or hopefully won't be damaged. The anterior pituitary produces the major hormones, which stimulate other endocrine glands to grow and secrete its hormones. The first one of those is the thyroid stimulating hormone, or TSH. Melanocyte stimulating hormone, MSH. Brenda knows what this is. Your favorite. It's your favorite.
Yeah, that one's really good. I know that one.
That's right. And it has a special stimulating hormone just to make it work. Go with the melanocyte, it produces melanin, right?
Yeah.
That makes it easy. It also produces adrenocorticoid hormone, which is the adrenal cortex. And they produce the cortisol and cortisol. Cortisol is really, really important under stress. Because when you are under a lot of stress, you'll have a high ratio of cortisol in your blood. Cortisol can be very damaging to tissues. That's why people suffer heart attacks and can't. If you've got a high cortisol level, you can't lose weight. So stress does have a big effect on your body. Follicle stimulating hormone, which is in the female, the ovarian follicles, where the eggs are produced. Luteinizing hormone stimulates the follicle and the ovum to mature. They're both involved in the sex glands. And these both work together as well. I know, I'm looking at them myself. I hate when I work 12-hour shifts. You get up at 5:30, 6 o'clock, and it's dark, and you get up work at 12, and it's at 7 at night, it's dark. It's going to be you'll get to do that when you're a nurse. I didn't know about that when I went into nurses training. I don't know what I was thinking. Nurses all went home at night and just left the patients alone. I didn't know they were night shift. I never thought of it. It was so silly. Afterwards, I thought, what was I thinking? Posterior pituitary, neurohypophysis. It's an 8th name. You might see that again. It produces 2 hormones. Antidiuretic hormone, which is used to either make the kidneys produce more urine or slow them down. It also regulates the amount of sodium in the blood. And it also produces oxytocin, which is baby stuff. So oxytocin can stimulate the contraction of the uterine muscles when you're in labor. And it also stimulates the let-down reflex when you're breastfeeding your baby. It also stimulates lung infection. It also is the hormone of attraction. I read that somewhere. It makes people bond. So that makes sense when you have a baby and you have a high level of oxytocin in your body. It is sort of bonding. But it also is apparently supposed to help adults. That was interesting. There's a diagram of the pituitary gland and its responsibilities, and I'm the one I gave out to you guys. It's just from a different book, actually. It's not from your textbook. It's from one of my other books. I just liked it better. I'm thinking about your textbook. The thyroid gland, which sits right here. It lies anterior to the thyroid cartilage, which is what they're talking about here. The thyroid cartilage is this lump here, feel here. It lies in the back of your neck here. You can actually feel your thyroid gland if you swallow, feel the lumps going up and down.
Swallow just to check.
Yeah, just to check. You shouldn't feel it. It shouldn't be too large. If it's too large, then you've got a thyroid problem. Okay. So it consists of 2 lobes. So there's a lobe on each side, and this just connects the little isthmus here. Connects the 2 of them. So it secretes thyroxine. And I'm sure anybody who's got low thyroid may be taking thyroxine in tablet form. It's the principal thyroid hormone, and it's T4. I'm sure you've heard T4s and T3s. T3 isn't as important or it isn't as strong. It just works with the thyroxine. So the triodine, actually triothyronine. It's a little bit of a hint in there because you actually have to have iodine in your system to make your thyroid work properly. And that's why we have iodized salt. The normal population of Canada apparently had a high rate of thyroid problems, and they have put iodine in the salt to help with that. If you eat a lot of seaweed, it has lots of iodine in it. Calcitron, you've seen before when we studied bones. It lowers the calcium level in the blood to inhibiting bone breakdown. So it's also the thyroid gland is responsible for the calcitron. The parathyroid glands, they're embedded in the posterior surface, so the back of this, we have little parathyroid glands. Pardon? Right, like in the this is the thyroid gland here. This is the pink here, and they're just embedded in this pink tissue. They're like little circles, and that's just an enlarged picture of a parathyroid gland. So like little pink circles in there. There's usually only 4 of them, but some people have more than others, or less. But 4 is the average. Parathyroid function, it increases the concentration of calcium in the blood. Has the opposite effect of the thyroid calcitonin. So it's the balance between the two.
I think it was my grandma had her
Parathyroid out, yeah, because they
Do
were.
they just take out the parathyroid?
Yeah, they do.
Okay.
Because they're overproducing and
Yeah.
they're imbalancing that calcium.
Yeah.
She may have had more than just 4. They could take out a few and would regulate it again. Okay. Did I cut it off too soon? Oh, sorry. I go back. That's okay. Oh, you got it all. Oh, sorry. I thought I cut it off too soon for you. Okay. Adrenal glands. Now they sit on top of the kidneys, one on each side. You can see like little points here on each side sitting on top. They're kind of like the brain. They have a cortex on the outside and a medulla on the inside. So the center part. They're divided into 2. So little pyramids. The pineal gland is located right in here, above the brainstem. It's a very small gland, it's the size of a pea. Maybe that's where the pineal comes from, but I don't know. But anyway, it secretes melatonin. Now, melatonin is the hormone responsible for your awake and sleep cycles. Peter and I were talking about that on the way up. Light, it's affected by light. So if you're exposed to daylight, the melatonin levels drop, so you can be awake. And when it's dark, the melatonin levels rise, and that's getting you prepared for sleeping.
That's why people have a hard time sleeping at night when they're not adjusted.
Yeah, that's in shift workers, that's right, they have a terrible time. Shift working actually shortens your lifespan by 10 It's just you're out of your biorhythm and you're not sleeping at the right times, and so it does shorten your lifespan. But melatonin responds to blue light. So anything that, like television, your computer screen, games that has a blue light will mess up your melatonin and make it difficult for you to sleep. So they suggest that you do not watch television or use your computer for 1 hour before you go to sleep. Otherwise, you'll have to. Yeah, that was kind of cool.
Another reason I have the team run and force you to even sleep.
Yeah.
There's some numbers too, they have to have a radio or something.
Great.
Yeah.
Yeah. I wonder if they're watching letters kind of listening to it and drifting off. I don't know. It must be.
I said that.
I can't sleep with it. I find light really bad. Like, I mean, if there's a little chink in the curtain, I can't sleep. So I close it all off. So yeah, light really.
That's me.
The pancreas, my favorite organ in the whole body. I should say my least favorite. It's not working. So anyway, so the pancreas lies between the stomach at the top. They don't show it here. Lies between the stomach and that first curve in the small intestine. So this is the one that belongs to both, the only one that belongs to both, the exocrine and the endocrine system. And we're just going to talk about that in a minute. So the exocrine is secretes enzymes for digestion, to digest your food. They're released to the pancreatic duct. Then they flow to the duodenum, the first portion of the small intestine, to assist with digestion. And I'll just go back here for a second. We're talking about this pancreatic duct here that goes down and secretes out into the duodenum. So if you wanted to continue with writing that, there's that portion of it. So the endocrine part of the pancreas is the pancreatic islets. Now, oh, hang on, my favorite one here. So the islets are just sitting within the pancreatic tissue. And islets, the word islet means island. So little islands are sitting in the pancreatic tissue. They're called the islets or islands of Langerhans. And Langerhans again is being repeated. That word again. Okay. So they're clumps of endocrine cells. Down before I start chatting about the next part. There's two types, alpha and beta. The beta cells are the ones that produce insulin. Very important. The alpha cells are the ones that produce glucagon. And I'm not sure if any of you are familiar with diabetic patients. If they have a low blood sugar, severely low, we actually give them injectable glucagon to bring it back down. Because the glucagon itself accelerates the process and converts the glycogen stored in the liver and skeletal muscles into glucose. So if you have a diabetic patient, type 1 or type 2 sometimes, but usually type 1, coming into the emergency department and their blood sugars are severely low, the fastest way you can bring them back up is to give them a shot of glucagon. They do have glucagon on car in the ambulances if they do come across a patient whose blood sugars are severely low, and they can actually inject it on ambulance. So beta cells secrete insulin. Insulin decreases the blood sugar, drops the blood sugar. Insulin and glucagon are antagonists, meaning they work against each other. Insulin decreases the blood sugar and glucagon increases. Surprised to many lay people. They think diabetics should never have sugar. They, and actually I heard a story of a young student who was, I think about 12 years old. He was an insulin-dependent diabetic, and he got onto the bus, and he was on the bus and realized that his blood sugars were dropping, and he just felt terrible. He started going around the bus asking anybody there for candy or something. The bus driver, not knowing that he was diabetic, thought he was just being disruptive and tossed him off the bus. So that's really frightening because, you have somebody who's going into hypoglycemic shock who now has been jerked off the bus and has absolutely no way to manage sugar. So fortunately, whatever happened, it worked out that someone came along and gave him some sugar. But the general public misunderstands diabetes to think that, diabetics can't have any sugar. So therefore, they may not offer them sugar. They see them behaving like they're drunk or having problems or asking for sugar. So it's kind of sad. Okay. So insulin is the only hormone that can decrease blood sugar, glucose or blood glucose concentration. So how it does that is it accelerates the glucose movement in the cell membrane. So it stimulates the cell to use more glucose. It speeds up the cell's metabolism, and therefore it reduces or decreases the circulating blood sugar level. And I mean by circulating what's in the bloodstream. So a normal blood glucose level, fasting level, after 10, 12-hour fast, is 3 to 6 millimoles per deciliter. So that's normal. For diabetics, you never want to see them at that 3. It should be 5 at least. Because at 3, we start getting confused. It's not good. So diabetes, we have just a quick chat. You're going to be seeing the gain. So there's 2 different kinds. There's type 1. So they produce no insulin at all or too little. The only treatment we have is to give them insulin by subcutaneous injection, restrict their diet, or it's a very healthy diet actually. And exercise also affects blood sugars. Type 2 diabetes, which you see mostly in the elderly, is an abnormal insulin receptors. They just aren't receiving the instructions insulin is giving the receptor to open up and let the glucose in. So they may have a decrease in insulin production. Type 2 diabetics are usually treated with oral hypoglycemics, a restrictive diet, and exercise. A lot of type 2 diabetics are overweight, and if they lose their weight, then they can actually return to a normal blood sugar and not have to be on oral hypoglycemic agents. Any questions about diabetes? When you get into diabetes in your nursing courses, diabetes is actually more of a disease of the vascular system. Because of the high blood sugars, it damages the lining of vessels. So then you get peripheral neuropathies, like nervous system problems. You get circulation problems. That's where diabetics get ulcers in their legs and feet, and hearing problems. And it's because of diabetes, the high sugars have affected circulatory. The hormone changes can alter intellectual capacities, memory, learning, and emotional states. And you see this most obviously when women go through menopause. Because of my age, I mean, I've had a lot of my friends go through menopause, and yeah, it can be very, very emotionally upsetting. And difficulty sleeping, sleep deprivation, the list of problems that the change in hormones in a woman causes are endless. Then also have changes. They go through andropause in that same age, in your 40s, 50s, 60s. And they also have some emotional changes, but usually not as severe as women.
They're like returning back to the teenage.
That's right.
You're like, how many teenagers?
I think the most problems that I've seen with my friends is hot flashes.
Yeah.
And just inability to concentrate, right? They're so kind of overwhelmed by not feeling well that they have trouble at work and things like just doesn't go well at that time. It's the other age group we kind of forget about is the teenagers, right? When they go through, their changes, obviously they have a lot of issues with concentrating too. They're more interested in what the girls or the guys are doing than schoolwork. So that's affecting them a lot. Aging, you'll see a decline in concentration, caused from growth hormones and reproductive hormones changing. Yeah. Oh my goodness, we are aging.
So dark out there. Yes, it is.
Oh, no. Oh, this. We're not going through this, are we? Okay, we're not doing this. Okay. I'm just going to quickly just read it. I'm sure the people at home have already seen this, but it is a stress response. Yeah. There's three different phases: alarm, resistance, and exhaustion phase. And Danielle is right now. You kind of push yourself a little too hard. Working, school. This is really all those steps. That's the whole story.
That's why I have a fat belly, because
your cortisol levels are too high, and you can't lose weight till your cortisol levels are high.
that's my
So, yeah, that is a good excuse. I like it. I'm sticking to that one too. Yeah. So the immediate response is the fight or flight, the reserves of glucose, and the hormone epinephrine again, fight or flight. With that, you have increased mental alertness, increased energy, and mobilization of extra energy reserves. Circulatory changes, we have a decreased blood flow to the skin and tissues and organs. We have an increased blood flow to the muscle, and that's your plate and plate. Okay. So then we have the glucocorticoid steroids are dominant and high energy men, and the glucagon reserves nearly exhausted. Resistance phase is more like you're using up all of the reserves. Exhaustion phase is what happens afterwards. Decreased immunity is a big one. If you are working all the time and stressed out all the time, your immune responses are poor. You get sick more often. Catch colds. Yay! Now it's time to study for the midterm. Any questions at all about the midterm?
Are you going to send us a review or no?
Actually, I had to bring my laptop because I didn't get time to set them up. Yeah. So I'm working Sunday, Monday, Tuesday, driving home Wednesday. So I will send them out in that time period, so you guys will have to read before the exam. Or I should get that before the exam. Hopefully I get them, Sunday night. I'm going to have to work. Yeah. Then I get off at 7:30. So what I might do is just grab a bite to eat and then just go downstairs. And if they have a Wi-Fi, yeah, and I can hook up to their Wi-Fi and then do it downstairs. So that's what I'm hoping to do. Yeah, I'd like you to have those because I think it would really, really help.
Yes. Are you going to be here on Friday?
Yes, I'm here. Vigilator. I like that word. I'm sitting there watching you guys. It said 3 hours, but I think we're going for 2. For some reason. I don't think it will take 3 hours, but we do have that. We have a small room that they set aside for us.
Oh, where is it?
They gave me the number, but it's on my laptop. So you have a tinier room and then it's one of these ones.
Maybe it's the input.
So if we decided to start at 12 because you want to write yours because you have a class in the afternoon, right? But you guys decided to do it at 1, or do you want to cut it 12? So all show up at 12. Yeah, just banana, right? Yeah, chew gum.
Yeah, exactly.
Banana, chew gum. Make sure you have food on board and your glucose levels are up. Not too much coffee.
Bring your plus.
Yeah, bring your. Is it noisy?
I don't know. I think you focus better.
Yeah.
Seem to focus like I know.
Yeah. Right.
I get
Hear
annoyed
what?
quite easily.
Yeah.
So,
Well, it is good because usually there's, especially at 12 noon, it's going to be lunchtime. People are going to be roaming around in the hallways, being noisy. I actually thought of that. Maybe I should put a big sign in the door. Right, yeah.
I think that would be good because some people start right outside the door and they're
And start.
it's a huge distraction. I find.
Great.
when we were writing our math for 5 o'clock, oncology, there were like little kids trick-or-treating outside, and it was like,
Oh my goodness, oh, that, yeah, and I'm not good at math, so that would have really bothered me too. Okay. Yeah, so your boots. Oh, thank you. They're so comfortable. I love them. Yeah. Okay, take care. Enjoy. Don't get all stressed out. Have other opportunities to sleep. Because like I said, you do your reviews and you do your quizzes, that's a good percentage of your mark. So that can really lift your mark. So yeah.
I think just all the things that everything said us for me.
Yeah.
As long as I like that's what I'm gonna do. Like I work just as you said it.
Yeah.
And I do like everything up on my wall.
Yes.
Because I know visual.
Right.
So if
Yeah.
I put everything up on my wall in words, then I can lay there and go over it, over and over.
Right. Yeah.
And that for me is great.
Okay.
I tried it hard to do.
I learn when I read or I study just before. For some reason, I don't know whether I think about it while I'm sleeping or what happens, but I seem to learn that before I go to bed. It's odd.
Yeah, I think you can that's why I started using
That's like, it's
Right.
not good decorating stuff, but it's all like, okay. Oh, this is pretty, nice wallpaper.
She said it was like the last one you're talking. We were like all kinds of stuff.
Oh, I have to tell you guys, I have a heart.
Yeah,
I got a heart. Yes, I got it yesterday. It's a cow heart. Yeah, it's big. It's about this big. It's like human heart, so this big. This big.
This is gonna be amazing.
So what? I don't know how I'm going to set up a camera for the students online, but I want them to participate. So we're going to have to set the camera as we dissect it. So I'm getting skeletals from the weekend. So I hopefully, but oh, I should have told you guys when we do the heart. I'll remind you any of these things. When we do the heart, we're close. They get dirty a little bit. It won't matter. I'll just put a big plastic thing on the table.
I overview everything so
Yeah, that's right. You probably had access to it.
Because I wasn't sure because we had done them.
Right.
Right, gear parts because
Yeah.
we got $2, right?
Yeah.
But I don't know if we get something to see about it.
Please do, then we could have the two hearts. We could actually compare them. They probably are the size, but something different. But also when you get your heart manually hunted, you'll have the pericardium stack around it.
Yeah.
Whereas if you buy one, they've removed a lot of stuff, so that you just get the heart, but you won't get the stack and everything. So if you can get a hold of that, it'd be awesome. So good. Yeah, that would be a bit bigger.
Yeah.
It's good to see if the heart's bigger, so I was glad to see that the cow heart was bigger. Yeah, it'd be really interesting. So somehow I have to organize the PowerPoint and doing it at the same time, but I think I can. I'll just say, refer to the PowerPoint and write stuff down while we're doing it. Yeah, me too. I've seen a human heart site in autopsy, and it really helps you really visualize what's going on. So it's really good. Yeah. But yeah, I can sort of, when I think of the heart, I can think of what I saw. Yeah. Yeah, it's really interesting. Yeah, so well, tell the others that have heart. Yeah, okay, take care. So we're all done for the day. Thank you guys for coming today.